Sit down. Thank you. So, you gotta chill. I know. Stop. Is it okay if I introduce myself?
Yeah.
Too? Okay,
Yeah,
so I'm Marissa. Marissa Bonnie is my last name, and I like she and they pronouns. I'm 35, and yeah, I am someone who's lived in Minneapolis for a long time. I'm also just kind of like who I am really quick too. I'm a Chamorro person that lives in the diaspora. My family is from Guam, and I'm also white. And yeah, I have been doing outreach and community connecting work more specifically in Minneapolis for like the past almost 7 years. And I did some stuff in New Orleans as well.
So I'm sure you've had lots of experience like navigating boundaries and like all of these different settings. And so I'm wondering if you could tell me a little bit about how you navigate boundaries and like maybe some of the lessons you've learned.
Yeah, I think I think it's great that you're asking and inquiring of that and expanding on what that can mean for people. But yeah, so I think that boundaries are really hard because I think, are always displayed as this like way to protect ourselves, and I think that can be true, but it's hard when you're doing it in a work environment or work setting. Like boundaries exist so many like on our personal level for our own lives, but when it comes to like work, it's really hard because some places have really intense boundaries. Like when I worked for the county, it's very bureaucratic. There's a lot of red tape, and there's things that like I wouldn't agree with in doing, right? But like that's what you have to do if you want to keep your job, or if you work around the boundaries, then like are you putting your job on the line, right? And like that's not necessarily also a way to access or like work with people who are wanting to access care. And like there's so much bureaucracy in the sense of a lot of our healthcare systems, and like what we're trying to connect people into care with is like based in whiteness, and it's like a very white Western medicine. And when it comes to the work that I'm doing, and it's primarily harm reduction and just outreach in general, a lot of the people, and like substance use or like drug use, and a lot of people who are accessing care are not white. A lot of people I've worked with are indigenous, and so when you're also trying to put people into boxes that they literally don't identify with or like quote unquote fit in, that is a failure. And it's like that's this like named like it's like this is our system, and I think systems are also like kind of like quote unquote boundaries, and it's like not what works for people, and that's why people keep being failed. And I think something else is like, there's this model of always having people meet you where you are, and like that's bullshit. And like it is 2024, and like if you're in a clinical setting and you're not at least partnering with people who are doing work outside of brick and mortar sites, then you're failing. And if you're not going into community to understand your like quote unquote patients or like quote unquote clients, then like, or like even trying to like put yourself in a position where you can connect with people better, expecting people to come to you is not a way to succeed. And so there's a lot of boundaries around like, I can only go into this setting, but like, I need to get this approved by my boss. And like, I have been in positions where like, I'm not supposed to enter buildings. I'm not supposed to take syringes. I'm not supposed to offer syringes, but the entire apartment building is IV drug users. Why wouldn't I do that? And so like, I may or may not have done it, but you know what I mean? Like, fuck the rules. When like there's an HIV outbreak, there's like hella people that need supplies, there's people that are actively using, and like I have a car full of supplies. Like, why wouldn't I do that? And so to me, it's these systems that like are not making sense, and they are named as boundaries, and they aren't always good for the person you're trying to connect with. And I think a lot of the time about accessibility, and like we expect people to like, in these like clinical or like service minds, like we expect people to want to access and engage in their care and show up to their appointments and do all these things. And like the reality is that people are dope sick, People are just sick. People have kids. People don't have transportation. People may not be able-bodied to do so. It might cost people money. Like, there's all of these barriers that don't work. People would always ask, like, can you do this for me? I would be honest, yes or no. That's a boundary. Yes or no? No? I'm sorry, I can't. Another boundary I think about for outreach is like, again, like space. If someone's asking me to come into their tent, or come into their car, come into their house, my answer is always no. And that's a firm boundary, because that can jeopardize my safety, that can jeopardize my liability, and that can also trigger me as someone in recovery. And also, like, that's just something I apply in my life in general. But like boundaries that will like protect you as a person so you can keep doing the work is what's really important. But when you don't know the people you're connecting with actually, like I see you regularly, but like I'm not gonna go in your house, and your house can look like a lot of things. Like, that's a basic thing that I will always respect and do. To me, it's also very colonized to just go hard because who else is going to do it and blah, blah, blah. And it's like this thing that's really instilled in us as people in America. And like, when do you stop? You stop when you think the job is done. But like, this work is never done. And like, that's kind of what's fucked up, or the horrible thing about when you're working with people is that there's never going to be enough services. There's never going to be enough funding. It is a repetitive cycle of systems for generations. And until a lot of systems start to look internally and dismantle themselves and rebuild them, these are just going to keep happening. And so in order for us to work in human services or social work or outreach or case management, or you're a counselor or whatever, is that you have to be able to advocate for yourself. You need to be advocating yourself for your mental health, your emotional health, your financial health, because you can't just do this work for shitty pay and a bad head. Where can you meet them where they are at, where they will succeed? But like, part of that is the person being accountable to their health and well-being, and you supporting them, not you doing the work for them so they access their care. And there's a way to do it where you're not babying people, because like, adults are adults. Like, I didn't just come into someone's life to save their life and like incubate them like a little baby egg. Like, they're a whole ass person with a whole ass life before I ever met them. So like, what's gonna work for them so they access care and it works for them, and I'm not doing it for them. And that, I think, is what I've been trying to say in this whole thing, is that we have to think about structuring care differently while also honoring ourselves and keeping ourselves safe. And that looks different for everybody. And I think really fighting for your health and well-being while helping others is so underrated. And it's said a lot, but like, it doesn't actually happen. So like, make sure you're doing that. What is happening, which like, I don't know that it aligns with if it's abolition, but it's like just what it should be, into my opinion, is like merging these worlds of like clinical and street work or outreach work or community work, like to where they communicate actually. Because like, if we all are keep in these little bubbles of care, we're gonna keep having to like think we have to rewrite a wheel. And it's like half of the work is like writing systems that already exist when someone over here is already doing it. It's like, just bridge, just connect. And the more you connect, the stronger you are. And like, the more you bridge, the more access to each other you have, to where the people you're trying to get into care or support, or if they want change in their life, then they have more options. And because we're in a world that's so, or a country that's so fixated on individualism and money and greed and like, how can we get the most data, how can we do this, and like, if that could be put aside actually and like really care for people, that is what abolition and care work is to me.